Hey there, Dr. Christianson here. Simple question, are dairy foods good for you? You know, there are many that have intolerances and reactions and lactose intolerance, casein allergies, many issues with dairy, and legitimately can be behind many tendencies towards autoimmunity, chronic pain, mucus, congestion, weakened immune response. But is it good for you? So if you could move past it, if you could desensitize, if you could heal up the gut, have it no longer be an issue, would it be something you'd want to include in your diet? Well, let's talk about that. So first off, let's really define what are the facets, what are the ingredients within dairy foods. So we've got a carbohydrate, which is lactose. Now lactose is called a disaccharide, so di as in two, and saccharide as in sugar molecule. So lactose is glucose and galactose. It's those two paired together. A big percent of adults do not have the lactase enzyme. We can't cleave it and pull it apart. When it's left together, it does carry a lot of water, which can create bloating, fullness, loose stools, discomfort, so there's that. Then we have casein, which is one of the two proteins of dairy. Casein is also what you make wood glue out of. It's a very binding protein. It really holds stuff together tightly. There's also whey, which is the watery protein. So Little Miss Muffet, curds, and whey. So the curds are the casein that clump together, and the whey is the watery stuff that goes off. Then we've got dairy fat. And dairy fat, we find that from butter, cheese, whole milk or whatnot. There are no essential fatty acids present in there, no significant quantities. And this is primarily saturated fat, primarily palmitic acid. That's a fat that we can synthesize. Our body can make it when it needs to. The essential fats being omega-3 and omega-6. Now, grass-fed dairy can have trace amounts, but honestly, it's a matter of like a dozen milligrams, not really an order of magnitude of 100 or 10 below what's therapeutic or helpful. So no essential stuff there. Now, I did leave dairy out of the Adrenal Reset Diet, and that was very intentional. There are a high percent of people who have cortisol abnormalities, who have chronic inflammation driving that. And when I see people clinically, we would measure for food intolerances. Dairy was one of the big ones. The majority of people would have some reactions to it. And oftentimes just taking it out would plummet the total inflammatory load. And that was a critical step towards really healing cortisol, was taking away this inflammation. Cortisol, it's a natural anti-inflammatory. So when your body's chronically inflamed, you will move cortisol in ways to try to manage that as well. So there are those that have dairy allergies, but a larger number that have dairy intolerances. And that's the thing that I'm talking about. Many that have chronic health conditions have dairy intolerances. So if you're past that, which is possible, and I've got another video which I'd encourage you to see and read the blog that goes with it that talks about how to move past those reactions. So if you are, how does it affect the health? Well, let's look at some research on that. So in the case of thyroid disease, here's a couple of considerations. People that have Hashimoto's are more sensitive to a higher intake of iodine. More iodine above 300 micrograms drives a thing called the Wolff-Chaikoff reaction. And that shuts off the thyroid and makes it more inflamed. Dairy is one of the higher sources of iodine in the diet. So a perk for many by avoiding dairy who have thyroid disease is just being on less iodine. The big wrinkle with that equation is the fact that thyroid medications have a lot of iodine. If you're on a 1 grain dose of desiccated thyroid, it's about 130 micrograms right there. And same thing for like a 100 microgram dose of Synthroid or Levoxyl. And if the target is less than 300 micrograms, you're probably getting at least 1 or 200 in your diet already. So with being on thyroid meds, you're at the upper limit. And every little bit you can avoid can work better to lower the thyroid antibodies and help you get more out of your thyroid hormones, whether you're making them or taking them. There's also a good many that have dairy issues that have casein intolerances. Not so much an issue with just a high reactivity to tiny amounts of lactose, but more so an issue with casein. And many have talked about how that was their big needle mover, was getting dairy out of their diet, some more so than wheat. Then with adrenals, I mentioned before about how there's this inflammatory cycle. If your body and your intestinal tract is carrying chronic inflammation, you've got to juggle cortisol to deal with that. So we've got to think about the intolerances, those that are sensitive to it, and you'll only know that through testing. And then we think about those that have disease conditions that don't respond well to it. If you've managed your disease state, you've cleared up the reactions, what does dairy do? What do the big studies say about those that consume dairy versus those that don't? You know, and this is an important thought about the thinking process. So not just the information, but how we really arrive at conclusions about health. You can see a lot of things about how in some context dairy may be bad, and it might be tempting to say it's just better to avoid across the board. But we want to really look at science. We want to say, well, if you've got millions of people that have consumed dairy and millions that haven't, how have they played out differently? How have their health trajectories differed? And that's a good way to think about if it's worth including or not. So here's some things we've seen. Body composition. So not weight in the scale, but body fat versus lean body mass. Many papers have shown consistently that dairy foods benefit body composition. They're actually helpful that way. Another consideration is bone density. Now, we've seen this consistently as well, that DEXA scores, bone density scores, are better in those that have more dairy in their diet. I want to throw a wrinkle into that last one. So that was bone density scores. However, we really care about bone density scores because we're concerned about fracture, especially hip fracture. And the data is very clear that dairy foods do not change the trajectory of hip fracture. So, we've actually seen this for some medications as well. There's many medications like bisphosphonates, Boniva, that they can make a difference on improving DEXA scores, but they do not change hip fracture risk. Some of them actually make it worse even. So dairy foods, they may benefit bone density. They do not seem to make a difference for hip fracture. So not a strong reason to consume them on that one. Now we think about cancers as well. Colorectal cancer, gastric cancer, breast cancer. Data is pretty strong. Dairy foods cut the risk of those. Strongest data for colorectal and gastric, some data, however, also for breast cancer. So those are some benefits that if you were at more risk for or concerned of, could be useful. Prostate cancer is different. So prostate cancer, which is a male exclusive risk, the data is mixed. Some data suggest dairy food does not affect it good or bad. Some data suggest that higher intakes of data, more than about 3 typical servings per day, may worsen the risk of prostate cancer. So there's that one too. And now with dairy overall, we think about what are the facets of it that are important. And it contains a good source, it can have a good source of protein. It can have vitamin D, the calcium's there. There's also the fermented versions. We've got the probiotic benefits that could be there as well. So it's also high in phosphorus. That's easy to get. That's not a big deal. The other things that it has, like lactose, which is just not a wonderful carbohydrate, more of a neutral carbohydrate. So something you go out of your way for. And then the dairy fats, this is not fish oil. These are not essential fats. These are not things that feed our brain. So they're there, and if you've got room in your calories, so be it, but they're not things you really need to seek out. They're things you can get pretty easily one way or another. So of that, cheese I would think of as more of not useful. So yes, there's the protein, but not much. And the main contribution is fat, and the main fat is not essential fat. So more of a discretionary food. Now milk, we've got mostly carbohydrate, small amounts of protein, but mostly carbohydrate. So in terms of the pie chart of your protein, fats, and carbs, milk is a carb. It makes the carb piece bigger and the protein piece smaller. Cheese is a fat. It makes the fat piece bigger, protein piece smaller. So milk also discretionary food, not something you'd want to put in your priorities for your calories. No things in it that you would not get otherwise. But a consideration, well, and of course, ice cream goes without saying, butter as well. Butter's been a topic to where it's been treated like a health food lately. It's not. There's nothing in butter that you could not get elsewhere. And the argument against sugar is really that sugar contains a lot of calories for no nutrients. You can say the same thing about butter. There's a lot of calories, but there's no nutrients that your body needs, that your body cannot make by itself. So consider that also a source of discretionary calories at best. The data is also strong that saturated fat, such as found in butter, is harmful, especially for those in the population that have APOE genotypes. A big factor for Alzheimer's risk and cardiovascular disease. The most recent paper on saturated fat and total mortality has shown that for every 5% you could swap out saturated fat For a polyunsaturated fat, you'd be looking at a 26% reduction in population mortality. Now, I know that there was a paper from 2015 suggesting that saturated fats were not harmful, but the drawback is that paper didn't distinguish caloric substitution. It didn't say saturated fat versus polys. It just said saturated fat versus whatever, which when you got into the details was mostly sugar and processed carbs. So all you could really say from that paper was that saturated fat is not worse than sugar. Like, okay, that's not a very high bar of accomplishment. It's still something that's not your best source for calories. So back to dairy though, if the trick is it's got protein, which is great, vitamin D, which is great, calcium, we could use some more of that, fermented stuff, which is good. So what does that come down to in terms of types of dairy that may be useful if you're not reactive and if you're not sick in some way? Well, that's unsweetened, denser versions of yogurts. So there's Greek yogurts that are around for quite a while. We've also got now the Icelandic yogurts, which are awesome. You know, the same benefit of Greek yogurt, which is less water, less carbohydrate, more protein, is even greater so in the Icelandic yogurts, which are also called Skyr. There's a product called SIG, S-I-G-G, which you can see in many markets now, and that does contain that. So let's say you've got stable adrenals, your thyroid's dialed in, your gut is healed up. Would you want to include that? Overall, I'd argue you would. There are some net health benefits for most people. Males at high risk for prostate cancer may think differently about that, rightfully so. And if the main goal is the bones, you wouldn't do it. There's no clear benefit for the bones. So think of dairy as a possible protein source when things are good, and especially the concentrated versions of yogurt. The data has shown that yogurt does yield those same health benefits, but also benefits to overall immune response. You know, less autoimmunity, less recurrent infection, and lower risks of other cancers. So I would consider that an occasional protein source, probably not daily. The drawback about those binding proteins is that even when you're not reactive, you can become reactive. But a few times per week, you could make your breakfast or your lunch protein some SIG or some other non-fat unsweetened yogurt and probably do well from that. So take great care. I always want to dig through the real science and make sense of what moves your health to the trajectory of greater homeostasis and greater well-being so that you can be back on your mission. Take great care of yourselves. We'll talk in really soon. Bye-bye.